Good morning. Welcome to the Intellectual and Developmental Disabilities Awareness Day Policy webinar. My name is Judy Reben, and I am the Associate Director of JFK Partners. Before we get started with the webinar, I'd like to cover a few housekeeping items with you. To preserve the audio quality, all participants will remain muted during today's webinar. If you have a question, please use the Q&A button at the bottom of the screen to ask the presenters questions. We will address your questions at the end of the webinar as time permits. If you'd like to make a comment, you can also use the chat button. Closed captioning is provided for this webinar today, and the webinar is being recorded, and a copy of the slide deck, as well as the recording, will be posted to the Awareness Day webpage by the end of the week, and that webpage is listed on this slide. Finally, don't forget to come back to the same Zoom link for our virtual luncheon from noon to 1. So next, I'd like to introduce today's presenters and co-hosting organizations. As you may know, IDD Awareness Day is co-hosted by 3 organizations, all of which are represented today. Through this event, we hope to bring awareness to the strengths and inherent value of people with intellectual and developmental disabilities. We also hope to highlight the challenges they face and how our state lawmakers can play a role in supporting them, their families, and their services. As I mentioned, I'm Judy Reben, Associate Director for JFK Partners. JFK Partners is designated as Colorado's University Center of Excellence in Developmental Disabilities, or UCED, and Leadership Education in Neurodevelopmental Disabilities. So we also have a LEND program. Our mission is to lead the way in evidence-based interdisciplinary clinical care, education, research, and community partnerships to enrich the lives of children, youth, and adults with IDD and special healthcare needs. Next, you're going to hear from Ellen Jensby, Senior Director of Public Policy and Operations for Alliance. Alliance is the nonprofit statewide association of community-centered boards and service provider agencies and strategic partners that is dedicated to strengthening services and supports for people with IDD. Additionally, you're going to hear from Cristiano Sosa, Executive Director of the ARC of Colorado. The ARC is an advocacy organization that promotes and protects the human rights of people with intellectual and developmental disabilities and actively supports their full inclusion and participation in the community throughout their lifetimes. So with that, we're going to turn it over to Ellen to kick off the presentation.
Thank you, Judy. Just quickly thumbs up if my audio sounds okay. Great. Thanks so much for kicking us off. So during today's webinar, we're going to talk about a few items that you see listed on your screen there. We're going to start off with COVID-19 policies and how they're related to people with IDD. And that's just going to be a high-level overview. We're not going to get into all of the nitty-gritty details there, but just kind of do a quick check on where we are this year with the pandemic. Next, we're going to talk about the direct support workforce crisis that we're currently experiencing. And then Cristiano is going to help us by going over some bills to watch at the Colorado legislature this year. And finally, we're going to finish up by talking about legislative advocacy and how you can get involved at any level. So first, COVID-19 policies related to people with intellectual and developmental disabilities. So during the pandemic, there were a lot of important policy changes that were made to help protect people with disabilities, both at the federal and the state level. So first and foremost, the federal government passed a law that protected individuals' Medicaid enrollment so that they didn't lose access to services during the pandemic for specific, financial reasons. And so that protected enrollment goes throughout the public health emergency as long as it's declared at the federal level. And we are currently still in the public health emergency and likely will be for at least several more months to come. So that is currently still happening. And then importantly, the federal government has passed a couple of temporary increases in the federal Medicaid match. For those of you who don't know, most disability services are funded through the Medicaid program, which is a state and federal partnership. And in Colorado, 50% of those funds are contributed by the state government, and about 50% of those funds are typically contributed by the federal government. But because of the pandemic, the federal government bumped up their portion of funding. And so right now we are getting an additional 6.2% throughout the public health emergency, as well as an additional 10% on our federal match. And those dollars have to be dedicated to improving home and community-based services, which many of you know are waiver services for individuals with disabilities. And that 10% bump is currently active, and it goes throughout the end of this month. But the dollars that Colorado is bringing in as a result of that 10% match can be used through 2024. So we have a significant influx of funding coming through to help us support people with IDD. The federal government approved a number of service flexibilities for Colorado to allow people to remain safely at home, but also still receive services, like the option to receive services remotely, the option for case managers to collect electronic signatures rather than visiting people in person, etc. And the state has actually adopted several of these permanently already. And the ones that they aren't going to adopt permanently will remain in effect until 6 months after the end of the national public health emergency. Additionally, Colorado adopted a new 3-tier day habilitation structure, which includes an option to receive services one-on-one, so one staff person to one individual in services. And this was done to allow people to receive services either in very small groups or individually to eliminate the risk or at least curb the risk of COVID. But previously, there wasn't enough funding for agencies to afford to do this, but now under this new structure, it's become a lot more possible for people. So that's exciting. Additionally, there were a number of temporary reimbursement rate enhancements enacted at the state level, and these were to help providers compensate for the increased staffing that they needed, hero pay for their staff, protective equipment that they needed to wear, as well as program losses due to people not being able to participate in the many services that they normally would have. One of the series of rate increases that came through was attached to a new requirement that provider agencies pay at least $15 per hour to their direct support professionals. And as I mentioned before, this funding was through the American Rescue Plan Act. It's temporary and it will run out in 2024. And so one of the things that we've looked at is how to make those reimbursement rate increases permanent so that we don't have a big wage cliff coming in 2024 that could cause an exodus of direct support professionals from the field. And finally, and very importantly, people with IDD were prioritized in Colorado's vaccine rollout. So they were able to access those vaccines early on in the distribution process, which played a big role in protecting them as well. And Alliance and the ARC and our other advocacy partners pushed out the Roll Up Your Sleeves campaign, which is the image you see on the left there, to help set up local vaccination clinics so that people could have a safe place to receive those vaccines. And as I mentioned, we are currently experiencing a direct support workforce crisis. If those of you who've been around a while know that we have decades-long issues with recruiting and retaining enough qualified direct support professionals to serve people with IDD. And direct support professionals are really the kind of front line of support in our field. They assist people with disabilities with a diverse range of activities. They help them with personal care tasks like getting ready in the morning, taking medication, job development services to help them find a job, and a variety of ways that they help them participate in social activities. And so because we don't have enough direct support workers right now, we are seeing some temporary program closures and waiting lists to get into services. We're seeing that especially in day programs where agencies just don't have enough staff to have the full capacity of individuals attending those services. So there's a waiting list. We also see providers turning away new referrals, delaying the launch of new services or expanding existing services, and facing unsustainable turnover costs. We've actually had some agencies have to call in National Guard troops to fill in the gaps for some of their residential settings. So those services that could not be temporarily suspended, and people really need around the clock support. Which is of course not an ideal option, but it was very important to be able to have that during the pandemic. And so of course the result of all of this is that people with IDD can't access the full range of services for which they're eligible. And they have to cope with continual staff turnover, of having new staff constantly coming in and sometimes helping them with their most intimate activities of their daily lives. And so it creates a lot of stress on people with IDD as well. And so how can the General Assembly help? Well, we have really great news. There currently is a provision in our state budget, which is being finalized this week, to make permanent those reimbursement rate increases that were funded by ARPA, the American Rescue Plan Act. Those are the ones that support a $15 per hour base wage for direct support professionals. And that will help prevent that wage cliff in 2024. So we're very excited about that and hopeful that stays in through the end of the budget process. In addition, the budget currently is going to provide a 2% increase for all Medicaid services. And we hope that that stays in as well, because some of those ARPA increases, they were targeted to only specific services. And so not every single service received a rate increase, but we are seeing workforce issues across the board. So that 2% increase would help agencies with recruitment and retention across all of their services. So we are very excited that the General Assembly is once again stepping up to the plate to support people with IDD and their families, and we look forward to seeing the budget finalized, hopefully with these provisions intact. With that, I'm going to turn it over to Cristiano to cover some important bills that we're tracking this session. Cristiano.
Thank you, Ellen. I have the distinct pleasure to discuss some of the bills that we're watching as many of our other partners, parents, and families that we represent. With 14 chapters throughout the state, serving 9,500 folks every year, with over 3,500 members, we can't do it without you. So thank you so much for being here today. Next slide. Thank you. This is just a small sample of the bills. We're going to point you to areas where you can just keep track of what's coming across the transom, what we're amending, what we're supporting, as well as the Alliance. But I wanted to highlight in just the brief time that we have together 4 bills that we ask for your support on this session. And the first one is, I think, is the inclusive higher education. And this really is a result of a bill that many partners helped get over the finish line in 2016 that expands opportunities for individuals with IDD in higher education. I think we all know there's some low societal expectations and limited opportunities that really prevent people from IDD from enjoying the benefits associated with higher education. We know through research that folks who participate in higher ed have higher employment rates, better wages, increased socialization, and really community belonging, those rites of passage that are just so important. So this bill expands the grant program run in 2016 and allows more colleges and universities to establish programs. We're really, really excited. We think that folks with IDD are untapped workforce for many employers, and the program is in high demand. So more to come on that one. The next one is about transportation. And I don't think I need to tell anybody on this call today that transportation is a challenge in a lot of areas and consistently ranks as a top concern or opportunity to improve life and access and getting to work on time. And with our sponsors, Representative Larson and Alex Valdez, we are trying to tackle that. People with disabilities lack accessible, reliable transportation options, really due to geographic capacity limitations and other challenges. And this bill aims to expand employment options by creating a path to allow companies such as Uber and Lyft, or what we know as transportation network companies, to serve people with disabilities through Medicaid. And the next bill that we ask for your support on is of behavioral health crisis response. And this bill was actually already signed by the governor, and it extends the statutory deadlines for healthcare policy and finance to secure a vendor to provide training specifically for people with IDD and co-occurring behavioral health needs. It also extends deadlines for case management agencies, mental health centers, people who work in schools and provider agencies to complete the training so that we really have a system of wraparound services for individuals experiencing behavioral health challenges. And we're very, very excited about this. The next one that I would highlight is the behavioral health crisis response system. Again, I think we're in very good company in that there has been some long-standing challenges for individuals with IDD and co-occurring behavioral health challenges where the services aren't quite geared, or there isn't the capacity to provide those services in a way that works for individuals. And this bill requires a crisis system including those walk-in centers and mobile crisis programs to meet minimum standards to provide these very needed services. It clarifies the populations that must be able to access those services. And we are very happy in working with our sponsors in getting an amendment that added people with disabilities and co-occurring conditions to the list of populations of people that must be served. Explicit language to ensure that folks can be served regardless of their primary diagnosis. Next slide, please. So there's some additional bills to watch. There has been a lot of work and a lot of advocacy and a lot of folks who I believe are on this call who have been part of the interim committees around behavioral health. And those bills are just starting to come over the transom. We have a big one coming up on Friday for hearing, 1278, and this is really about the establishment of the Behavioral Health Administration and a revisioning of what that might look like. So I would have folks pay attention to that. And Ellen, maybe you can talk a little bit about the early intervention. Oh, sure. Sorry, I skipped a slide there. Okay.
I did too. So yeah, the early childhood bill I will chat about because our community center boards currently provide early intervention services for children age 0 to 3 who have developmental disabilities or delays. And so this bill would establish the functions and responsibilities of the new Department of Early Childhood that was created through legislation last year and will become effective in July of this year. And in an effort to kind of bring all of the early childhood programs under one roof. This bill would relocate all of those programs that currently exist in the Departments of Human Services and Education into this new Department of Early Childhood. And it also would create a Colorado Universal Preschool program. So this bill is actually about 400 pages long. Our team is still reviewing it, and so we haven't taken a formal position on it yet. And I believe there will be many amendments coming down the line as well. So we'll be closely watching that one. So for those of you who are interested in even more bills, you can check out the online bill trackers for Alliance as well as the ARC of Colorado. And at those websites, which you'll be able to access when we post the slides, you can find a description of each bill, what our positions are on them, and then you can find links to read the text and more things like that. So if you want to be a bill junkie, that's how you can get started. All right, and then moving on to legislative advocacy. Some of you on the webinar are probably, this is old hat for you. You've been around and you know how to get a hold of your legislators. You may even have long-standing relationships with them, and others of you may be just starting out. So we're going to talk about how to get involved at every level. So beginner advocacy, we look at actions that would take for about 2 to 15 minutes. And sometimes that's all we have time for, but it's important to know that we can still make a difference even with just a couple of minutes of time. So some of those actions might include just finding out who your representatives are, who represents your district. And so there are websites there for the state, as well as your members of Congress to find out who represents you at a state and a national level. And then a really easy way to get a lot of information about issues that are important to you are to connect with organizations you trust. And so that might be an organization like the ARC or Alliance, or really any variety of other entities. And you can follow them on social media. You can sign up for their newsletters. A lot of organizations will have a weekly newsletter that comes out with updates on legislation that they're following. And you can also respond to their action alerts. So usually organizations will send these out when it's an important time to contact your legislators to let them know your position on a bill. That might be right before a hearing, or it might be part of, a national day of action on the federal level. And they'll have you use email tools or make calls to your legislators to let them know your point of view. Of course, you can register to vote, and that's a very important step to register, as well as to vote when elections come up. And then you can program your elected officials' contact info into your phone. That might be their Twitter handle or their phone number or their email address so that you can easily contact them when the time comes. At the intermediate level, we're looking at actions that take about 15 minutes to half an hour. And this would be things like learning how your legislators voted on important bills. So organizations that you trust will often have bill trackers or scorecards, and they'll show, here's a piece of important legislation, here's our position on it, and here's how your legislator voted on this particular bill. And so you can use that to reach out and thank your legislators when they vote in favor of something you like, or when they oppose something you don't like, or you can reach out to them for additional advocacy to ask them to change their position. You can also call or visit your legislators to discuss issues that you care about. And of course, this is something very critical to let our legislators know what issues and needs we have of them while they're in office, because they're there to serve us. You can also write a letter to the editor of your local newspaper. Often things will get seen by legislators, and they'll know that that's important in their local communities. Or you can volunteer to help a candidate. You can, walk and help them get votes during an election period, or you can volunteer to help another organization of your choice with various events that they have. We have some volunteers for Awareness Day today, so they're helping out with that. And finally, advanced advocacy. These are things that take an hour to a full day of time. And these are things like attending or testifying at a hearing where they're discussing a bill of interest to you. And on the left there, you'll see some images from 2020, actually. This is before the pandemic. And we had a large number of people at the Capitol come to one of the hearings on the developmental disabilities waiver waiting list. Everybody showed up in blue to demonstrate the interest among our community for this particular issue. You could also attend a candidate forum or town hall so that you can ask legislators directly about their stance on issues that are important to you. And finally, creating a lasting relationship with the legislator is a really effective way of having some influence. So if you're an ongoing resource for them and they know that in their community, you're someone who knows about disability issues, when an issue comes up at the Capitol, they might just call you instead of the other way around to ask you for advice on how to proceed. So those are some ways to get involved. Now we're going to pause because we have some time for any questions that are coming through. And I know that there's at least one in the chat box. So let me pull that up. See if we can tackle these. All right, so, oh, Cristiano, it looks like you responded to the question that was posed there. So I'll just give a short recap for those who may not be reading the chat. So the question was about what is being done to help first responders when they're responding to an event with a person with a disability. And we know that there have been some recent poor interactions. And Cristiano helpfully put in a link, or not a link, but a reference to a bill that would help to train first responders and help them to improve their interactions. And it also includes some coordination with other settings such as emergency rooms. So thank you so much, Cristiano. That's all I see in the chat box, and I don't see any questions from the Q&A. Oh, wait a second. Here they come. So we'll just give you guys a minute to enter your questions. So Tammy is asking, is there an annual event at the Capitol in Denver to celebrate IDD Awareness Day? So actually that event is today. That's why we're hosting this webinar. And later there will be a virtual luncheon where a few folks, will be at the Capitol to represent us there. But of course, because of COVID, we're not all going to the Capitol today. So during the virtual luncheon, you'll be able to watch your legislators walk the red carpet and hopefully give sort of a shout out to their local communities. And we do hold that annually, and hopefully next year we'll be able to be in person again. All right. Katie, it looks like you're having issues seeing the link. So unfortunately, because of the way Zoom works, you can't access the links directly from the presentation as we're showing it today. But when we post it online, you'll be able to access those links. And then there's a request for a link to that bill about first responders. So Cristiano, are you able to pop that into the chat box, you think?
Yes, I will try. Thank you, Jill Pidcock, Executive Director of the ARC of Central Mountains, for pointing out the post bill that I mentioned earlier. She is on that commission working to ensure that folks with disabilities and individuals with intellectual and developmental disabilities are front and center in that training. So thank you, Jill Pidcock, for your work there.
That's great. And Joe, I think if you just Googled it too, you could find it. But I think Cristiano's going to work to get that link directly into the chat box for you. So not seeing any additional chats or Q&A, I'm going to move to the next slide. There we go. So thanks everyone for attending the webinar. There again is the webpage where the slides and recording will be posted. And then, of course, stay tuned for our virtual luncheon, which I already mentioned, from noon to 1 p.m. That will be on the same Zoom link. And that's where you'll get to see legislators walk the red carpet and give a shout out to their local communities. Cristiano will also be over there in his bow tie, helping to coordinate. There are a couple of things in the Q&A, so I'm just going to check on that real quick. So Linda, unfortunately, I don't have an answer to your individual question about when the dining rooms will be open in your independent living center. That might be a better question for someone at the ILC or at the state. I'm just not super familiar with those regulations, so I apologize.
And I did drop into the chat the first responder bill, which is really just a tremendous improvement. And we have a question from Jenny Jordan. Have you seen an increase or decrease of advocacy involvement during COVID? In some ways, having sessions like this via Zoom seems to reach more people in a wider area. Jenny, I absolutely agree. I think we've been able to embrace technology in new and different ways, particularly on the awareness front. I think there are a lot of lessons that we can learn from COVID in terms of how we embrace technology and how technology, it's going to be around for a while. And so how can it be part of the landscape in terms of community integration? We're absolutely excited about those opportunities, and there's a lot of work to do.
Yeah, that's great. Thank you so much. And just to add on to that, one of the things that was added during COVID that didn't previously exist was the option to testify remotely at the Colorado legislature. So that was an exciting opportunity for people who live in rural communities to actually participate in that. And finally, Kristen, you have a question about how you would get information on hearings, things that you could participate in. Cristiano, do you want to take that one, or would you like me to?
Go ahead. I'll try to get the link sorted here.
Thank you so much. Yeah, Kristen, so that's a great question. So actually the bill trackers that I posted earlier, I believe they will give you updates on where the bill is at in the process. And so they'll kind of highlight, the next committee that might be considering that bill. Often if you get, weekly newsletters from organizations that represent your views, they might tell you, there's an upcoming hearing on Tuesday at this time, and they might even provide a link to watch or participate. And of course, those action alerts that come out periodically will give you instructions on how you can communicate directly with your legislators. And sometimes they'll also give you information on how you can join. But in the absence of any of those things, if you know a particular bill that is important to you, for example, on the state level, you can go to the Colorado General Assembly website and type in the bill number, and then it will pull up a web page. They have a page for each bill, and that shows the status of the bill. It'll also tell you when it's next going to be heard, and so then you can click on the committees where it's going to be heard and even sign up to testify that way. So it can be a little bit challenging to navigate the first couple of times, but once you do that a time or two, it's pretty straightforward. All right.
I will say improvements at the Capitol in terms of technology have really been astounding, and it really helps when folks would like to testify, but live in Durango, and an 8-hour road trip just might not make sense for a 3-minute testimony. The virtual technology really, I think, is more inclusive for the needs of the state. And so I think that's been a really, really good improvement.
All right. Yeah, thank you. Let's see, Tom Turner. Just checking out your question, Tom, so that I can elaborate a little bit as you requested in the chat box. Do you anticipate the higher education bill to expand that availability to colleges on the Western Slope? And looks like Cristiano answered that one. I assume you're referring to the higher education programs for people with IDD. And Cristiano, do you have any more to say about that one?
That's right. Yeah. We have already been in conversation with the Institution of Higher Learning on the Western Slope, who is very interested in creating a program. So I think that's absolutely fantastic. And this bill allows for that and helps fund that. You know, if we could lean into folks to, if the bill is passed with your help, if we could lean into folks in terms of awareness of this opportunity, I think that'd be fantastic. And we'd love to work with anybody to ensure, if this is a good fit for a community, that they would be able to apply in the process.
Awesome. Sounds like you answered the question. And if that's my friend Tom Turner coming out of retirement to join this webinar, it's good to see you. All right. Just give it one more second for any final questions. All right, everyone. Well, thank you so much again for attending. It is our privilege to be able to bring you this information, and we hope to see all of you on the virtual luncheon back on this same Zoom link at noon to watch the festivities over at the Colorado State Capitol. With that, we will sign off for the morning. Thanks so much.
Thank you all.